Welcome to the Wow MD podcast, where in each episode you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Cernăianu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. As I promised in a previous episode, actually, I probably promised this in a few episodes, the time has come to talk about IV vitamin therapy. It is a great alternative form of therapy, and it is a therapy, but it's really far from mainstream medicine, which is unfortunate. The people leading and taking charge of restorative therapies, unfortunately, are not conventional medicine doctors or conventional medicine bodies, regulatory bodies. But those bodies are very quick at regulating and restraining. So every time you speak to a conventional trained medicine doctor about IV vitamin therapy, please expect them to be skeptical about IV vitamin therapy because they have received zero training on this subject. There's no training in medical school, there's no training in residency, and there's no training at any of the conferences that doctors normally go to for various specialties that are what we call CME approved, continuing medical education approved, because there is no standard of care regarding vitamin therapy, especially intravenously. Now, should your doctor go to an anti-aging restorative medicine training, that's a whole different ballgame. In this case, your doctor will likely receive some training in IV vitamin therapy. And of course, that does not come for free. They not only have to pay a course fee, but on top of that, there are usually many hours that are put into not just attending the conference where they teach you what to do, but literally studying the pros and cons of various vitamins, the what, the how, and the why to administer them intravenously, the dosing, what to look for as far as side effects, how to gauge the clinical response, and how to create a treatment protocol, and so on and so forth. Now, I'm personally somewhat new to the IV vitamin therapy, just a few years, probably 3 or 4. It's really hard to get vitamins in the state of California. It did take me a very long time to get committed to implement an IV therapy program. I personally had to study the pros and cons, to look into the possible side effects, into the negatives, to look into how much this will benefit my patients and whether or not this was going to be making sense for the practice and for the men and women that we serve. Now, because I'm a restorative anti-aging practice based on holistic principles, because I believe, above all else, in allowing the body to heal by providing the body its needed nutrients in the form of vitamins and supplements, protein powder, amino acids, hormones, peptides, etc., I decided that IV vitamin therapy, after weighing pros and cons and learning about it, would be something I need to get behind. So I did. In recent years, especially since the pandemic, IV vitamin therapy has gained enormous popularity as a wellness trend. And it is literally promising to rejuvenate and energize individuals in a matter of minutes. Some people do get the infusion and they feel it right away. They're like, oh my God, I feel like Superman the next day. But what exactly is IV vitamin therapy and what makes it so appealing? So in this episode, and probably the one to follow, I will get into the nitty-gritty of this innovative wellness approach to nutrition and health. And I will attempt to answer various questions like, what is IV vitamin therapy? What are the medical conditions that would benefit from IV vitamin therapy? How long does an IV vitamin therapy session last? How often do you need IV vitamin therapy? Are there side effects, and what are the side effects and the negatives of IV vitamin therapy? And then ultimately, last but not least, what vitamins are available to actually be administered IV, intravenously? So first question, what is IV vitamin therapy? Well, IV vitamin therapy involves the administration of vitamins and minerals directly into the bloodstream through an intravenous drip. This method of delivery for both vitamins and minerals and amino acids and whatever other nutrients are available, like glutathione and NAD, will bypass the digestive system completely, allowing for immediate availability of nutrients to the body's cells at a rate of literally 100%. If you have not listened to my previous podcast episode, this is a quick, short reminder. I did discuss bioavailability. That is the percentage of the drug, vitamin, nutrient, or hormone that will reach our circulation. And of all the options available to introduce something in the body, orally, nasally, transdermally, vaginally, only IV administration has 100% bioavailability. Apparently, even if you take oral vitamins, a very small amount of that dose makes it into your bloodstream and would ultimately be available for your cells to use. For example, let's take B12. Everybody has heard of B12. Everybody has taken B12. It absorbs at a rate of less than 10%. It is estimated that only about 10 micrograms of a 500 microgram supplement is actually absorbed in healthy people. That is 2%, people. So even with the best of diet and even with oral supplementation, there will always be a need for IV vitamin therapy. So next, I'm going to discuss the medical conditions that would benefit from IV vitamin therapy. Well, obviously, number one is vitamins. So what do we use vitamins for? For vitamin and nutrient deficiencies. There are many who suffer from severe nutrient deficiencies and vitamin deficiencies who cannot absorb them orally. And they will clearly benefit from IV administration of those vitamins, maybe intramuscular injections. So let me talk the next reason, the next medical condition that would benefit from IV vitamin therapy, malabsorption syndromes. You might be at this point like, what the heck is that? Well, clearly it's an absorption problem. And there are a great many conditions like Crohn's disease, celiac disease, ulcerative colitis, chronic pancreatitis, or something called short bowel syndrome that drastically interfere with nutrient and vitamin absorption, making IV vitamin therapy extremely useful for anyone who suffers with these conditions. Otherwise, these people that have these conditions will simply not break down the food into the essential nutrients, or they will simply fail to absorb them into the circulation. Now, outside of these very obvious digestive conditions, other medical conditions that interfere drastically with our nutrient and vitamin availability? Well, anyone who had a surgical removal of a part of their bowel, the small intestine or the large intestine, which is also known as the colon, will have impaired vitamin absorption. Anyone with SIBO, if you have not heard of SIBO, we all have a little bit of SIBO. It is known as small intestinal bacterial overgrowth. So anyone with SIBO will have vitamin deficiencies for multiple reasons. Because the excess bacteria in the small intestine, and just as a recap, this is when the colonic bacteria that normally lives in our colon, the large intestine, overgrows and overcomes the normal lack of bacteria that exists in the small intestine. So the excess bacteria in the small intestine that doesn't belong there will consume the nutrients, including the vitamins, before the body has a chance to absorb them. And this is very common with vitamin B12, but all the B vitamins. Also, the excess bacteria in the small intestine will affect your bile acids. That's what the liver makes and stores in the gallbladder and releases periodically. Those bile acids are necessary for fat digestion and for absorption of fat-soluble vitamins. In my next episode, I'll talk more about the difference between water-soluble and fat-soluble, but just quickly, the fat-soluble vitamins are vitamin A, vitamin E, vitamin K, and vitamin D. Vitamin D is a fat-soluble vitamin. The excess overgrown bacteria in our small bowel can also damage the intestinal lining, which can lead to the inflammation of the intestinal lining, and this will affect the capacity of absorption for all vitamins. It will also interfere with the metabolism of the vitamins and nutrients, causing them to transform into inactive forms or totally different compounds that the body can no longer use, rendering all the vitamins and nutrient ingredients useless for the body. I'm going to repeat this, even though I talk about it on social media quite a bit, and I might have said it before in another podcast episode. You can eat all the healthy food in the world, and you can take all the top-notch expensive vitamins in the world. You could end up with very expensive poop. What other medical conditions interfere with the absorption of our vitamins, causing malabsorption? Well, gastric bypass, gastric sleeve, simply known as bariatric surgery, can do that. Well, hello. Weight loss surgery is known to cause vitamin deficiency and malabsorption. It is well-established fact that approximately 250,000 people a year get bariatric surgery in the United States. Let's ballpark that at about 5 million people over the past couple of decades. It is well known that the water-soluble vitamins like the Bs, the folate, and the vitamin C, and all the fat-soluble vitamins, A, D, E, and K, also minerals like iron, zinc, selenium, calcium, magnesium, and copper will be depleted and will have significant difficulty absorbing post-bariatric surgery. Malnutrition is listed as a common long-term complication after bariatric surgery. What's mind-boggling to me is that people who have had bariatric surgery do not have routine vitamin level testing and replacement of these vitamins with regular injectable vitamins once a week and perhaps IV vitamin sessions at least monthly. Again, mind-boggling that their doctors who are following them for their overall health do not talk to them about malabsorption, do not test their vitamins, and do not administer vitamins. Maybe because there's no money to be had or made by doctors in vitamins. Another issue is damaged intestinal lining from infection, inflammation, and prolonged use of antibiotics. All of these can cause malabsorption. Fatty liver can interfere with digestion and absorption of nutrients. And most people with gallbladder problems will end up with many nutrient deficiencies. How about IBS? Well, IBS, especially diarrhea predominant, that's like a no-brainer. It's super fast transit. So from mouth to out, it's much quicker. It's just not enough time for the food to be processed and for the vitamins to be extracted, right? So IBS with diarrhea predominant, specifically diarrhea predominant, but all IBS, especially constipated people, will have some malnutrition because those who have it will want to avoid the foods that worsen their symptoms. So they will restrict their diet. So they will miss out on a bunch of nutrients. And then IBS itself impacts negatively the body's ability to absorb nutrients, leading to significant deficiencies. So I had surgery, I had SIBO, gastric bypass, damaged intestinal lining from infection, inflammation, prolonged use of antibiotics, fatty liver, IBS. I had Crohn's disease, celiac disease, ulcerative colitis, chronic pancreatitis, gallbladder disease. Is there anyone that's listening to this podcast that does not have one of the things that I just mentioned? A study published in the American Journal of Gastroenterology in 2019 showed that 2/3 of Americans questioned have some form of digestive disturbance or serious digestive disease. Think about it for a second. It means that 2/3 of all the patients walking through the doors of any doctor's office are going to have some form of vitamin deficiency. And what do we do with that? Well, nothing. How many times have you gone to a doctor, well, unless it's my office, that asks you, hey, let's test your B12, let's test your vitamin D, let's do a micronutrient testing. Let's look for your mineral panel, your B complex panel, your antioxidant panel. You can do those tests easily with Quest or LabCorp. Probably no one. But you can ask for these tests and you can be informed. By the way, you have to be off any vitamins, just regular diet for about, they say up to a week, but about 3 to 4 days before you do the test. Okay? So what other medical conditions benefit from IV vitamin therapy? Well, what about cancer? This could dedicate its own episode. I'm not a cancer specialist. I'm not going to dwell on this, but we know that there is significant benefit from IV vitamin therapy for cancer patients and for many reasons. Obviously, some cancer patients use IV vitamin C to potentially improve quality of life. and reduce the treatment side effects, the cancer treatment side effects. And high-dose vitamin C specifically has been used as an effective tool to help keep the cancer cells in check. And apparently in super high doses, vitamin C can kill cancer cells. And it's no longer an antioxidant. It's a superoxidant. Not to our cells, but to bad cancer cells. What about other issues with cancer? Well, think about the chance of nausea and vomiting with chemotherapy is 60 to 80%. And that means a few things. Number one, cancer patients will not be able to eat and drink a normal amount of vitamins, minerals, and nutrients while they suffer from the nausea and the vomiting. Sure, we can give them medication. We can give them Zofran. We can give them other medications, Phenergan, so on and so forth. However, they will restrict their intake of food and the vitamins are going to bother them. So they're simply going to not take them. And most people on cancer therapy are being told to stay away from vitamins, which is also mind-boggling by itself, but that's another subject for another day. Number two, the digestive lining of the cancer patients that have been treated with chemotherapy will suffer significant, drastic, and dramatic changes due to the chemotherapy, significantly impacting their ability to absorb nutrients from food. Once they've recovered from the initial nausea and vomiting, they get back to regular food. But guess what? Now your gut lining is messed up from the chemo. You can't absorb it. Number three, our immune system requires certain vitamins and minerals like vitamin A, vitamin C, vitamin D, vitamin E, selenium, and zinc that need to be available in an optimal amount in order for our immune system cells to fight off the cancer and repair the damage caused by the cancer drugs. Well, what about amino acids? Number four, for your information, cancer wasting is a complex metabolic syndrome estimated to account for about 20% of the death of cancer patients, especially when they have lost over 30% of their weight. It was estimated somewhere by some study that 50 to almost 86% of cancer patients would eventually suffer this syndrome of wasting with anorexia. The levels of amino acids are very low in these patients that have cancer wasting syndrome. A standard treatment for patients who suffer from wasting syndrome remains very elusive, but nutritional interventions showed some improvement to the quality of life for cancer patients. So obviously, supplementation of intravenous arginine and lysine might be particularly important and necessary to stimulate protein synthesis and repair. On the other hand, proline and glutamine support cancer cell growth and are to be avoided. But leucine can help promote muscle growth and repair in these patients. And again, some of these amino acids are available for IV administration because cancer patients that have anorexia in terminal stages can have improved quality of life if they receive IV vitamin therapy with amino acids. There's much more to be said about the benefits of IV vitamin therapy in cancer patients, but this is beyond the scope of today's podcast episode. So let me return to the other medical conditions that could be helped by IV vitamin therapy. How about chronic fatigue syndrome and fibromyalgia? Many patients report symptom improvement with IV vitamins. And why? Because chronic fatigue syndrome and fibromyalgia are both diseases of the mitochondria. They're what we call mitochondriopathies. And most likely some degree of serious vitamin deficiencies involved. So flooding the cells repetitively with vitamins that are directly available into the bloodstream that don't have to be extracted from our food have shown to improve mitochondrial dysfunction, alleviating the symptoms for chronic fatigue and the debilitating pain from fibromyalgia without needing to use any pain meds. Also, let's not discount the fact that IV vitamin therapy is an effective dehydration treatment. IV fluids, sometimes containing electrolytes and vitamins, are used to rehydrate patients very quickly and very effectively. I personally ended up in the ER with some stupid dehydration. I took this spironolactone medication at the beginning when I started my pellet therapy, and I worked in the garden. It was a super hot day in November. Again, we live in California, very hot. I was gardening. I didn't pay attention to drinking water. And by the time I sat down to dinner and I had a little tiny glass of wine, at the end, I went and sat down on the couch and I felt like I was about to pass out. My husband thought I was having a stroke. Called the ambulance, ended up in the ER, bunch of questions. What did you do? Well, I took this medication. I drank a little wine. I even had an alcohol level checked by the ER doctor. It turned out it was 0. I had already processed a little bit of wine. But long story short, they started an IV. They gave me a bag of fluids. It was like the lights came back on. It was extraordinarily shocking on how the dehydration affected my brain capacity to function and almost made me pass out. Well, I never took that spironolactone again. My blood pressure was really low by the time I arrived in the ER, actually by the time the paramedics arrived. But long story short, dehydration, IV vitamin therapy is very effective. What about post-surgical recovery? Well, IV nutrition with vitamins and amino acids can support a faster and easier recovery, especially because after surgery, oral intake of food and vitamins is insufficient. The body suffers from loss of appetite, from constipation, from gastritis directly related to the surgery or the medications prescribed after the surgery that are needed to control the pain, the nausea, and reduce the risk of infection. Now you get antibiotics, which mess you up even more, right? IV vitamin therapy can also be used for immune support. Some individuals use IV vitamin therapy to strengthen the immune system, especially if they are prone to frequent infections. They get frequent flare-ups of Epstein-Barr viral infections, of herpes. They're very useful for long-haul COVID and many more situations like detoxifying from toxic mold and other things. Now, last but not least, and this is what launched IV vitamin therapy on the wellness market, the hangover relief clinics. IV vitamin drips were marketed first and foremost for hangover recovery. They worked really well, so they became famous. And from there, the demand continued growing. They now were needed to help recover faster from a viral illness or after a viral illness. The demand started to rise. Let's get a drip before we have a major trip. Let's get a drip to decrease the risk of disease after we have gone on a major trip, where we've flown a lot and we're in steel tubes, pressurized steel tubes with a bunch of other people that were coughing and sneezing. And especially since the pandemic, this literally raised the level of paranoia quite a bit. Again, where there is a need for a solution will appear. And it seems that IV vitamin therapy with vitamins and nutrients and antioxidants is the perfect solution for many of the conditions that we suffer from. Ultimately, to kind of end the episode on this note, obesity, it's a disease of malnutrition. And many of the obese and overweight people suffer from some degree of vitamin deficiency and mitochondrial dysfunction. If you want to know more, revisit the episode. I believe I entitled it The Hidden Truth Behind Our Weight Gain, the reason why we cannot lose weight, where I talk about inflammation, mitochondrial dysfunction, and ultimately all of these messed up pathways and mitochondrial dysfunction are really come down to one thing: the stress, the damaged gut, the interference with the absorption of the nutrients, the poor intake of poor quality foods. They all lead to major vitamin deficiencies. And we think, okay, well, I'm going to eat poorly, but take this great vitamin and it's going to make things equal. It doesn't work that way. If you have a damaged lining, your extraordinarily expensive vitamin will end up in your poop, not absorbed, and it will not make a difference. So there's a major place in the wellness holistic look at restorative medicine to use IV vitamin therapy. And hopefully, at some point in time, California regulatory bodies will realize that as long as this is regulated, it's useful therapy and it should be allowed, permitted, and safe for patients to use, rather than patients needing to go to shady clinics where you don't know who is giving you the therapy, who is prescribing the treatment. You have these protocols that are like a menu at a bar, kind of like buying a cocktail. You buy a cocktail of IV vitamin therapies. You don't even know if that cocktail is going to benefit you. You go by the name that the cocktail is given. So more on that in the next episode when I talk about specifics of different vitamins. And in the next episode, I'm also going to talk about How long should you expect for an IV therapy session to last? How often do you need them? What are the negative side effects? And more about the specific vitamins that are available. So lots to talk about. I might continue beyond the next episode into another episode. I do want to talk about glutathione as well, so please stay tuned. There's more to come. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas, so please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.